Thank you all for joining us for our regular Mass AITC webinar series. So today I'm not going to do the formal introduction, but I'm just going to let you know that you're in the right place if you're here to see Heather M. Young, professor and founding Dean Emerita of UC Davis sort of nursing. And I'm going to eventually turn this over to Holly to give a formal introduction. But before that, I want to sort of highlight sort of our upcoming speaker who will be Professor Dr. Joseph E. Gogler from University of Minnesota, who will be sort of continuing the conversation I think we have today, following up on sort of aligning technology with dementia caregiver needs. And so we're really privileged to have a nice set of speakings on this important topic surrounding caregivers, which is an important issue in dementia and older adult care. And so without further ado, I'm going to stop screen sharing here. So if you want to register, I'll also drop a link in for next month. But I'm going to turn it over to Holly to introduce our speaker and allow Heather to get her slides up. So thank you.
So we're so very pleased to have Dr. Heather Young join us today for a talk on healthy aging in a digital world with a focus on promoting caregiver health and well-being. Dr. Young is a nationally recognized expert in gerontological nursing and wears many hats at the University of California, Davis campus. She's the Associate Vice Chancellor for Nursing at UC Davis Health and was the founding dean of the Betty Irene Moore School of Nursing, with an important national fellowship program that she leads. Dr. Young is also the co-director for strategic partnerships with their Family Caregiving Institute. Now, both Misha Pavel and I have had the privilege of working with Heather recently as part-time visiting professors at UC Davis in their Healthy Aging in a Digital World initiative that she co-leads. She's an inspiration, a true visionary in how best to care for older adults, and her vast research in the area of technology and aging, as well as her lived experience as a caregiver, makes her just an ideal speaker for our group. I'm so very pleased to have Dr. Heather Young talk to us today. Please go ahead, Heather.
Thank you so much, Holly, and thank you everyone for being here. I really appreciate you joining, and I look forward to spending the next hour with you. I'm going to be talking with you about two of my very important worlds, areas I'm very passionate about. One is about healthy aging in a digital world, and the second is around family caregiving. And so you'll get a bit of a convergence of my interests today as I talk with you. My plan is to discuss a little bit about family caregiving. Who are the caregivers? What are their needs? What's going on in family caregiving? And then to talk a little bit about the power of data about family caregivers. And then how can technology support family caregivers? And then I'd love to have you let me know your questions and have a discussion. And I'm really eager to hear about your work and your thoughts as well. So Rosalind Carter, who just recently passed away, said there are only 4 kinds of people in the world: those who've been caregivers, and these are the people I care for right now, current caregivers, some past. My parents, my dad passed away. My mom has dementia and lives with my husband and I. My father-in-law, who's turned 100 last week, and lives on his own in his own home. And my uncle and aunt who are in Scotland, and I'm a distance caregiver for them. And so these are 5 people that are very near and dear to me, and people that I've spent a lot of time caring for. There are people who will be caregivers, and I think that's probably all of us who are on this call. And then those who will need caregivers. And that picture is of me on the right when I broke my leg and I suddenly needed caregiving in a very profound way because I wasn't able to bear weight for 3 months. And so I suddenly found myself in a position on the other side of the fence, and it was quite an eye-opening experience. And many of you, I'm sure, have had those kinds of opportunities to understand your vulnerability. So this is a definition of family caregivers that was put forward by the Raise Family Caregivers Act. This is under executive order from President Biden. A group was appointed to look at family caregiving in the US and the needs, and to make recommendations to Congress. And a report came out in 2021. And this is the definition that I think is a very helpful definition to sort of level set who we're talking about. It's a significant personal relationship. It could be a friend, a family member, a neighbor, somebody that you care about in some way. It's an activity that provides support so that family members and close friends can maintain their independence, dignity, engagement, and or quality of life. The caregivers provide the support without a formal assessment. So you just find yourself doing it and you're not necessarily sure what you're getting into when you start this journey. Family caregiving is becoming ever more common and ever more complex. And I'll talk a little bit more about that and why. And the experience, no matter how emotionally rewarding, can leave caregivers financially, emotionally, and physically depleted and socially isolated. So you can tell from just this introductory slide that family caregiving is something that is an important issue around both health and well-being and our social connection. There's a tremendous amount of diversity among caregivers. And when you think about this, it's an intersectionality issue when you start to imagine all the different types of diversity. First of all, who's the care recipient and who's the caregiver? How are they related to each other? You know, it's very different when you're thinking about your partner versus your child or your parent or sibling or friend. There's a number of characteristics of the caregiver that, of course, are going to shape their experience, their age, gender, sexual orientation, cultural background, immigration status, religious affiliation, whether you're working or not, what kind of resources you have, and where you live in relation to the person you're caring for. And we're learning more and more that this is an issue that happens across the lifespan. I just met a person yesterday I'm at the American Society on Aging meetings, and I met a person who's started caregiving when she was 9 for a disabled parent, and she was the primary caregiver. So it really does run the range of the entire lifespan. There's also different experiences that people have, and experience in the kinds of skills you need to be a caregiver. And so that's a diversity right there. What the care recipient actually needs, and what are their strengths? What are they able to do, and where do they need support? How long it's been going on, and what the trajectory looks like. If you're talking about a condition like Alzheimer's disease or a related condition, it can be anywhere from 12 to 25 years that someone has that condition. And so the caregiving trajectory can be quite long. And it also depends on how far along in the process, what the demands of the situation will look like. Also, other diseases come into play that can result in family caregiving, such as ALS or Parkinson's disease or chronic heart conditions. And all of those have their own conditions and issues around what medications someone's on, what kind of symptoms they have, what are the implications for their function. So each of these things put into play a very different scenario of need for family caregivers. What are they responding to is very different. And then there are the issues around how's the caregiver doing with all of this? What are their mental and physical health conditions? When you look at aging couples, people in their late 80s or 90s who are caring for each other, sometimes you can't tell who the caregiver is. And both of them may have, one may help with one thing and the other person's helping the other person with something else. And so their physical and mental health affects their ability to care. Motivation and relationship quality. There's situations where there's been a very poor relationship between an adult child and a parent. And maybe the parent was abusive when the child was younger, and then they find themselves needing to be the caregiver. And that sets up a very different dynamic than when you have a high quality relationship. There's this issue of other family obligations. If you're a working caregiver in your 50s and you've got children, maybe grandchildren, and you've also got parents, you find yourself torn between the different roles and the different responsibilities. That's always been termed the sandwich generation of caregiving. But yesterday I heard a really good term for it, which I think is actually way more apt, which is it's the panini generation, because you really are squeezed and you're in a hot position while you're doing it. There's also a difference among people in terms of their ability to communicate what they need. And what's going on with the healthcare team, with their families to ask for additional support, and how well they're able to advocate for what they need. And that's a variable that comes into play. And then, of course, the community connections that someone has and the strength of the network around them. And I have to say, as a family caregiver, even though this is my field, I've been studying this, I'm a gerontological nurse, I've been in the field for way too many years. Even when, with all of the expertise that I've had professionally, when I faced it personally, in caring for my dad when he was very ill, it brought me to my knees. It's not a matter of necessarily your knowledge, but the strength of the network can make a huge difference. And I often thought, if I didn't have the colleagues and friends who are experts, I don't know what I would do. And it makes me really think about the people who don't have that kind of network and the privilege that I have when I come to this myself, and what happens when you don't have that. So all of these factors come into play. So when you're designing and thinking about caregivers, it's not a one size fits all kind of a proposition. There are many dimensions that will affect how they can respond and what they can do, and how they can, what types of supports they need. I want to give you a little bit of statistics about family caregiving, and it's a little bit of information this is from the Caregiving in the US survey. This is a survey that's fielded about every 3 to 4 years, a combination of the National Alliance for Caregiving and AARP. They sponsor this. It's a national probabilistic survey, and they are able to get a representative sample. And what they found in the 2023 survey was that now there are over 53 million adults who care for a spouse, older adult, or special needs child. 10% of these are long distance. And this is an underestimate, really, because if someone says to you, "Are you a caregiver?" you have to identify as one. And there are many people who are providing help and support for somebody, but they say, "Well, it's my job. I'm a daughter, or I'm a husband. I would do that, of course." And they don't think of themselves as a caregiver. So this is probably underrepresenting the true number, but it represents 1 in 5 households in the country that are engaged in caregiving. And that's a lot of people doing this. And yet you think about it, it's quite invisible. We have a lot of comfort in talking about what's going on with kids in the world and, engaged in their work and activities, but we often don't talk about what's happening with our caregiving. And it's just as prevalent as the kinds of issues in other parts of our family and social life. We also know that about a fifth of the workforce are functioning as family caregivers, or trying to function while they're family caregiving. That caregivers on average provide 26 hours of care per week, and that about a third are doing more than 30 hours a week. So it's not a light commitment. Caregivers represent all ages, races, ethnicities, slightly more women. And these are the things that I think are really important. 40% report stress, and almost half depression or anxiety while they're in the role. And about a third reduce work hours, and about a fifth have limited their career opportunities, so denied promotions. And when you think about the economic impact of that on a lifespan, if you're 50 years old and you reduce your work hours and your maximum earning years, you're going to have less accrual to pension, less accrual to Social Security benefits. You might end up not having coverage, and it can really affect your own well-being financially when you get to be older. So it is something that is not just in the moment, it's a financial hit, but it also is a gift that keeps on giving in terms of that financial hit. We conducted a study a few years ago called the Home Alone Revisited Study, and we were very interested in understanding what kind of complex care caregivers are engaged in. And so this was a study that I worked on closely with colleagues at AARP. Susan Reinhardt and I were the principal investigators of this study with the Public Policy Institute there. And what we found is that caregivers, unlike the past, when people often thought about caregivers as being those who were caring for someone with dementia, which is still a lot of people are doing that, but more and more we're seeing people caring for lots of different conditions, and that caregivers are providing much more intense and complex care. Part of this is because of the fact that people are getting older and more people are living with chronic conditions. So even if you have dementia, you might also have a heart condition or other kinds of issues. The other thing that's going on is that hospitals are discharging people quicker and sicker. So they come home earlier, and they come home with needs around medications, wound care, a variety of different things. And in the past, when I was an early nurse, people would stay in for weeks, and now they go home as an outpatient after a surgery. And so families are picking that up and doing that, and often without the preparation that they need to be able to do that. And so more and more people are doing these kinds of tasks, medical nursing tasks. Over half of care recipients out there have some kind of cognitive impairment on top of these medical nursing tasks. And medical nursing tasks can range from anything like medication administration to adaptive equipment, monitors, technology, monitors and sensors, a variety of different things. We also found that caregivers are diverse, and so are their experiences. There's definitely not one size fits all in what's going on for people. Another aspect that I thought is really important for all of us who are thinking about technology and how to support caregivers is the findings around social isolation. There is a large number of people who are socially isolated. Almost half of caregivers report feeling isolated, or not having a choice about providing care. And those people who are either isolated and or not having a choice are much more at risk. They have more stress. They're much more likely to feel the pressure of the vigilance and the unrelenting nature of it. They are much more likely to perceive what's going on as difficult than people who have support. Same thing is going on from the outside looking in, but they feel less strain. People who are isolated like this also worry about making a mistake, that they're going to hurt the person they're caring for, which is a very heavy burden to carry. And they experience more strain, depression, sleep problems, and poor health. So there are certain caregivers who are much more at risk for problems than others. Out of this work that we did around family care and this intense care, we decided that we really needed to develop some resources. And so we developed some educational resources that are on this website. We've got over 50 videos that are 3 to 4 minutes long. They were produced to address the common medical nursing tasks that people have to perform as caregivers. So these are geared towards the caregiver to help them. So I've just been told I have to give my mom eye drops. So here's a video that shows you how to do eye drops safely. There's wound care, there's managing assistive equipment, things like getting somebody out of a car into a wheelchair, very practical kinds of things, pain management. And so all of these different videos were designed and developed to help caregivers with the issues that we heard in our surveys were the most commonly identified problems that they faced with medical nursing tasks. So I offer this to you as a resource. It's on AARP's website and available free for anyone. Along with it are some instructions that are in writing. And for healthcare professionals, we published a series of articles in the American Journal of Nursing explaining for each of the series of the type of video, the evidence behind it, and then also tips for how healthcare professionals can use these videos with caregivers. So it's something that is a resource that you could look at as well. I'm going to switch gears a little bit and talk about my current work with my team at the University of California, Davis and the Family Caregiving Institute. We're working with the state of California to assess and understand the caregiver support network that is funded by the state. And this is an incredible opportunity to get some very real data about who the caregivers are and what they're actually doing. So there are 11 care resource centers in the state of California, and they're depicted here, and they serve the entire state. And they receive funding from the state, and they also get some Title III funding that enables them to provide services like respite and counseling. And these are places where people can call and get information, they get referral, they can have an assessment, and they're able to find out what's available to them in the community. And our team is working with them to evaluate. They implemented an online platform to assess the caregivers. And so our role has been to evaluate the implementation of the online platform and then to look at the data that we've been able to get from this online platform to help to shape and guide decisions around program improvements and work. So this client record system was actually created by the Family Caregiving Alliance in San Francisco, led by Kathy Kelly, which was her brainchild. And it's a cloud-based HIPAA-compliant interactive database that is for caregivers. And it's one of the first comprehensive databases available in a community-based service agency You know, we're used to getting the electronic health record in health systems, but it's not typical in community-based agencies to have something like this. And it's a statewide database with a standardized assessment that assesses both the caregiver and characteristics of the person receiving care. And it's interactive, develops a client dashboard. And so if someone were to report, I'm having sleep difficulties, it pushes out educational materials and supports around sleep. And it would then have a care plan and the ability to communicate and follow up. How is this helping you? Do you need something else? And the great thing about this is it does provide huge amounts of data. And we're able to, for the first time, really understand at a state level, what are people actually dealing with and how could we really design programs to address the actual needs more thoughtfully. So I just want to show you a flash of last year. This is the 4,433 new caregivers to the system last year. There's thousands more in the database, but this is just a glimpse of last year. And you can see that it's a phenomenal database in the sense that we have tremendous representation across the lifespan. People start, 18 to in their 90s are caregivers and care receivers as well. It's gender. There's a predominance of women. And then on the racial ethnic identity side, it's a diverse database with very good representation from the Latino community, Black African Americans, and Asian American Pacific Islanders. And so this gives us the ability with the size of a database to actually do some deep dives into issues that these families are facing within subgroups as well. And we're using this data now to look at equity issues in California and to do some deep analysis on equity issues around caregiving, which is beyond today's talk. But just to share a little bit about who these people are, just so you can get a glimpse, just like I was mentioning for the national state study, a large number of caregivers are working, but many are decreasing their hours, quitting their jobs, or somehow not working as much. We have a good number who are below the poverty level and some who are living in rural communities as well, and a mix of different types of relationships to the care recipient. This is the part that is startling to me, was to see how much care this group is doing. Remember, I talked earlier about a third of people are doing 20 hours a week. In this particular group of this sample, who are those who've raised their hands and said, I need help. So it's a biased sample in the sense that they have sought help. Almost 75% are doing more than 40 hours a week of care, and they're providing intense care. ARP rates intensity of care according to how much time and what they're doing, and we use their rating scale, and 2/3 are at the most severe level of intensity, so very complex care. And for long periods of time. We have here over half of them have been doing it for more than 2 years, and about a third for more than 5 years. So it's a long commitment. And the thing that I think is most important to take away is they're not getting that much help. With this amount of care, almost 70% receive no paid help, and almost half get no unpaid help. It means that no one in the family or anybody else is helping them with this. So no wonder if people feel isolated and they're dealing with a lot of complexity. So out of this, CareNav was launched, and it's an interactive platform, and it really begs the question, so can an interactive platform help caregivers? And we were really eager to see how this would go. And so it was launched in 2019, and there was quite a bit of tech support and an ability to get people going on it. Even after these years, which is now 3-4 years into it, only a quarter of caregivers are using CareNav. We're getting the data that I shared with you earlier when family consultants in the care resource centers are contacted by phone, and they ask the questions by phone. So 75% are phone collected, but 25% get online and do their own data entry about their situation. But it really makes me wonder about, so how does technology help if only 25% are able to get on? So we asked the question of the people who are not logging in, why? What's going on with that? And I thought, well, it's probably because they don't have internet. Well, it turns out that is only 4% of the reason now of why they're not getting on. Too confusing is only 1.5% of the reason in the last year, and this is over 1,000 people we asked about it. Technology experience isn't so much of a big deal. Some people think they don't need it, but the biggest factor is they didn't know about it. A third of them say they don't even know about it. So that public relations and marketing is a very different problem than digital literacy. And so I think it's important to kind of dig in when you see people using or not using something, and figure out, well, why? What's actually going on behind that? And that the solution to this problem is going to be very different than the solution if people were to say, I don't have internet. So these are the kinds of things that we need to think about. And remember that the group I was talking about, almost a fifth are below the federal poverty level. So even those who are very poor still have access to internet. So it really helps to unpack a little bit what might be barriers. I want to talk a little bit more now about some of the solutions and technology that we're thinking about, and I know a lot of colleagues are working on. I'm part of the Healthy Aging in a Digital World initiative at UC Davis, and I'm so grateful that Holly and Misha were part of that with us as well as visiting professors for a while. And what we're trying to do is think about how technology can promote healthy aging and social function and physical function. And one of the things that I think about a lot is how can technology help caregivers, and have asked caregivers a lot of questions about this over the years. And here are the things that I've heard from caregivers. They need more information. They want to know how to do what they have to do. It's hard to find the information they need. If they're not in the house, like if they're at work or they're living in a different place, they want to know if there's a problem. They want to be alerted, and they want to know if there's a safety issue. They want to make sure that things happen that are supposed to happen, like meals and medications. They want to be able to stay in touch and communicate. They want to be part of the care team. So when the person who has what that they're caring for has to go to visit with the care team, the caregivers want to be in the loop with that so that they actually know what was decided, what's coming next, and what does it mean for me? Do I have to help with something new now? So they want to be in that loop. They also are interested in a break and getting some emotional support, and then tools to manage their own health and manage the health of the person they're caring for. So this is kind of a spec list of what kinds of things might we design for and think about that could be supportive of caregivers in their role. And it's not the exhaustive list. These are the most common things that I've heard. As we've thought about this, my colleague Tom Nesbitt and I have been thinking quite a lot about enabling technology and how it can support people as they age, and also how it could support caregivers. And we think about this in a number of different domains. We think about it in the domain of the body. So what technologies attach to the body, whether it's sensors, things that can monitor somebody's vital signs, their mood, medication adherence. There's some of those devices and abilities now to actually see if someone's swallowed a pill, where you can track whether the medication has actually gone into the body. There's also sensors around where they are, and also gait and movement. There are a lot of devices that can be in the home, and these devices can be things that support function. So reminders like medication dispensers. They can also support safety, detect if there's a problem like falling or somebody doesn't get out of bed. They can also be manage the home in terms of the temperature of the home and the smart nature of the home to be able to support somebody. But also more interactive things from the home with rehab gaming and robotic assistance. Those kinds of things can be part of what happens in the home. We also think about the community and how to link people to the community, whether it's the caregiver or the person who's being cared for. Social communication, connecting for information, connecting for ability to manage health conditions. And then there are the linkages to the healthcare system and those with the team, and thinking about how to connect and have interactions that are health related, consultations, and also the power and the potential of the analytics and the artificial intelligence from collecting data about people and their experiences and their lives that can actually then loop back and inform care and inform planning. So a lot of communication devices, I think, can be very helpful for family caregivers. And it, of course, whether you're in the home with them or whether they're at a distance, it depends on what your specifications would look like. But communication to help with connection, to support routines, to engage. There are a lot of wonderful tools now that we can do so much online, and caregivers at a distance can manage things like bills and prescription ordering and some of the household kinds of chores, smart home controls, and care coordination. And there's right now, for example, I'm using a baby monitor with my mom who's in a different place. She's in a cottage on my property, and I can see her and see what's going on when I need to, with her permission. And we can talk two ways, and it gives her the autonomy in her space. But when she needs something, she can yell out, and then I can come and help her. So it's something that's very helpful for her to be functional where she is. Lots of Helping Hands is a web-based place where caregivers can get informal support and organized support from their broader network. And there are a lot of resources like that. And there's more promise and excitement around voice-activated supports and being able to get people engaged and by using voice because of the barriers that people face in being able to manage technology. Remote monitoring is something that is, of course, becoming ubiquitous. And there's hundreds of thousands of apps now, but there's the ability for being able to monitor major health conditions and medications and vital signs and safety. So these are all potentials that are incredibly helpful for a caregiver to be able to monitor a person that they're caring for and to understand, interpret their symptoms and know actually, understand what to do for them to support them with their health. Medication management is a really big challenge always. And knowing, sort of understanding what needs to happen, when it needs to happen, and avoiding the errors that happen with medication. And it's well known that the medications can cause as many problems as they solve. And when they're not taken properly or they're taken or missed, that can really have a big problem implication. There's also the home and really connecting technologies to be able to monitor routines and to prompt and guide and support someone through the day. And if you're a distance caregiver, having the knowledge that somebody is able to get up and about and know what they're doing through passive monitoring that's not invasive can really be helpful. And especially if there's an alert system built in so that people are able to know when someone's out of their normal routine and a reason to follow up. I want to talk a little bit about Alyssa Weekly's work, and this is a person that both Holly and Misha have mentored, who's at our faculty at University of California, Davis. She's developed an interactive program, iCare, which is a web-based platform that enables a family caregiver to help to manage a situation and can do it from a distance. It really enables that. And it is a communication device for a person with mild cognitive impairment to be able to see what's going on and get that information from their caregiver. So there's a page where they come in and it gives them sort of what's going on in the day, what to expect, what's coming up with events, and who's going to be calling them. There's a calendar function that the care team, the family members who are helping can add things to and see what's going on. There's the ability to look at a to-do list that helps to prompt someone to get through their day. There's also a social interactive chat platform where you can get in and have a conversation as well. And then there's also a repository of information that's useful and helpful that people might need. And so this is something she's been developing, and I'm excited about her work. It was just featured in USA Today a couple of weeks ago as being a resource. And so she's really working on this project with great success. And then robotics is another area that we're seeing more and more interest in and more adoption of robotics to help support activities of daily living and to understand and anticipate and also provide social connection for people who are living by themselves and for caregivers to be able to interact through a robot with a person if they're at a distance. So as I think about technology for family caregivers, there are a few things that I always think is sort of a checklist of what are important considerations. One is, of course, access to technology, and there's the issue of connectivity, which is really can be a challenge in rural communities or in places where there's some dark spots of not having connectivity. Technology literacy and the availability of tech support. Those are factors. I think the cultural and linguistic appropriateness is an important issue, and so much of what's been written in many ways is in English, or it's written at the wrong level, and also may not have the cultural sensitivity that's necessary, and that's a very important aspect. Privacy, understanding what the values and preferences are of the person receiving care. Making a decision to have something that's monitoring a person is a big decision. And even with someone with dementia, with mild cognitive impairment, has the right and should be engaged in deciding how much privacy and what does privacy look like for them. In my mom's case, for example, she asked for a way for me to be able to see her. She was afraid and wanted to know that if she had a problem, I would know about it. And so she asked for something that would do that. But it's not something I would have imposed upon her without that kind of conversation, or conversation early in the disease process, so that when they get to the point where they can't make decisions, you're able to know what they would have wanted. Security is always an issue, lots of data moving around, and some of the platforms are HIPAA compliant and some are not. Some don't need to be, but there's always that concern. Costs of technology, and of course, much of it is coming down in cost, but there are still prohibitive costs for someone on a limited income. And then tailoring and integrating the technology. I think this is the thing that, with so much capacity that so much technology has, it's easy to throw the entire thing at a person or as a family. And when they only need certain functionalities, and tailoring it so that they get the max of what they need to, without the overwhelming nature of having too much to be able to understand and interpret, especially if there's cognitive limitations or it becomes too overwhelming. And also with all these different technologies that are available, rather than having all these standalone gadgets that are many different things around, the challenge of integrating all of those so that there's some coordination among the technology so it yields the greatest benefit for a person who's using it, and it can be actually useful. So I'm going to pause there and stop sharing, and I'd love to have a conversation with you and hear what's on your mind about these issues as well. And you can place questions in the chat. And so there's one in there already. How could we help older adults to accept technologies when they've had a hard time to learn how to use them? They may complain that they're not useful or not for them. Yeah, a lot of people don't see what, you have to approach it with what people need, what problem they're trying to solve the most. What do they want? What do they need? And then show how can technology help. So when I'm trying to introduce technology to an older adult, I always ask, what are you looking for help with? What do you need? And it might not be a technology solution. It might be something else. But if it's a technology solution, then it's an opportunity to say, well, technology could help you, and here is how, and to really show what that looks like, rather than just assume that a verbal description is gonna make the difference. So I think it's very important to design around what people need and want. What I've found in my work is that you crack the door open a little bit, and you start with what they really want and need. And as the confidence builds, then oftentimes people are asking for more. They want more. They want to try different things. And once they're comfortable, they're more open to being offered things like, well, you're doing this really well. Would you like to add this to what you're doing? And then you're much more likely to get that adoption. And the other thing that's been very helpful is peer support. And in some of the work that I've done, it's about getting early adopters to come in there. And there's always a technology geek in every room. and it's true with older adults as well. In my work in retirement communities, we'd always find those people who are really eager to be technology adopters, and train them up and help them to learn. And then they would work with their peers and coach and support peers. And that's a way that is a much more acceptable approach in some ways. So then please discuss youth caregivers and the USA policy on youth caregivers. Yeah, I'm not sure what the question is about the USA policy. youth caregivers. I would say that there's not a lot of, they're somewhat invisible. There is a National Association of Youth Caregivers now that is really ramping up their policy and advocacy efforts at this point. They're estimated to be about 5 million caregivers who are under the age of 18 in the country at this point. And those caregivers are usually children of parents or grandparents who have disabilities or have dementia or aging issues. And I think that it's a growing group of people, particularly as you've seen a lot of people in middle age fall out of the family unit for various reasons, just as there are many grandparents raising grandchildren. There are also young people helping grandparents in ways that we've never seen before. And it is an area that we do need some more attention for sure. How are these programs doing at expanding inclusion even further? LGBTQ folks, access for secondary caregivers or expanded care teams, and bridging urban-rural tech differences? That's a fantastic question. Right now, we're working on an equity plan in California, and it's around the issues of equity, and the way we're defining that is along all of those dimensions. In the data set that we have, about 10% are LGBTQ, and the state of California is doing a survey of LGBTQ elders at this point that is also going to inform our work. And there are absolutely important differences in approaching and the kinds of educational needs people have and support needs. And oftentimes it's a family of choice that may not be recognized extensively and appropriately by the healthcare system. So navigating and making sure that there are the right types of systems in place around things like advanced directives and powers of attorney, those kinds of issues are really even more critical in the LGBTQ community. We also have a lot of people who are caregiving teams as families. There may be a primary caregiver and then there are others. And so getting that kind of ability to engage the family, who whatever that family is and however it's defined by the person with their different needs, is another part of that. The rural-urban issue is a very big one as well. We're doing some geo-mapping of services to caregivers, and it's no surprise, but people in rural communities have way less access to the resources. One of the good things about the pandemic has meant that we've been able to do a lot more virtually, and many caregiver services have gone virtual, including support groups and educational opportunities. And so we're doing a bit better on bridging the urban-rural, but some of it has to do with connectivity. And so the broadband connectivity kind of plays into that. And then there's the aspect of tech support to get people really active on that. I see a hand is up. Dr. Deanna Gannison?
Yes, yes. First of all, thank you so much, Dr. Young. I mean, this is a fascinating discussion. One of my questions, I think, is, Misha put it in the chat as well, which is, we have a lot of pilots which are developing a variety of technologies, that have to do with caregiving, right? So everything from early detection to these days, the use of large language models and, various types of synthetic video generation and so on, which I assume, presumably could be useful. But I think I'm curious, and I think this is similar to Misha's question. I think a lot of them would really value the ability to both interact with people like you or people in your organization just to give the input, but maybe even for you to think about piloting some of the promising ideas within your something like CareNav. I'm curious if you've done that before, how you think about it. Obviously, you can't funnel all of the technologies into something that you actually roll out. So how do you think about it, and what resources do you have to?
Yeah, we're very, very open to that. And there are a number of researchers in our team that have an interest in that. And we're actually currently also recruiting more to build our team even further to be able to accomplish that. But yes, that's something we're very interested in doing. We do have some facilities at our place that include simulation spaces that are both primary care based as well as home-based. We have a one-bedroom apartment that's set up to be able to do testing. And then we have a clinical setting like a hospital-type space. And so there's some of those spaces where we're able to bring people in and do testing, and we're able to bring caregivers in to work and to do some beta testing with different types of technologies. So that's of interest. We're very closely associated with the Alzheimer's Disease Center on the Davis campus, and so there are researchers there who do a lot of that work that we can bring in as well. So it is of interest to us for sure.
Great. I think David
It takes
might
a
follow
village
up.
to do this.
Yeah, that's great.
Yeah,
I have
please
one,
do.
sorry, I do have one question, which is when you think about the feedback from caregivers, I mean, do you feel that the gap is more in knowing what to do under a particular circumstance or actually doing, actually sort of using a device or there's two different roles of technology. One is in helping them navigate the what should I do next? And the second is the robotic part of it is actually helping with the execution, like actually doing something. So where do you see the biggest gaps?
I think they're both, actually. Even for a person who becomes a caregiver, you start at a certain place in the trajectory and the needs change. So, you can begin caring for someone who's got a progressive neurological problem. And when you first start, maybe the issues are, just basic instrumental things like remembering to take your meds. But then in a few years, you start to have some physical needs as well, or you start to have some complex medication regimens. And so it's going to evolve. And so for caregivers, where they start and what they go through, there's always new things that they need to be learning and doing. So that's an ongoing thread of information. There's also the issue of, oftentimes what will happen, someone will go to the hospital and they'll have a really complex situation. And so the team gives them all this information. It's a barrage of information in about 5 minutes or 10 minutes. And then they go home and they say, now, what the heck did they tell me? I mean, what am I supposed to do? And then when they actually sit down and try to do it, it's even more complicated. So there's that piece of trying to pace the information in a way that's helpful. As far as using technologies, it has to be useful. It's got to be something that people find to be helpful. Otherwise, they won't use it. And I think when it is useful and it's accessible to them in the way that they can get onto it and use it, and it provides them the information or the prompting that they need, that sets you up for success in a different way. So that gets back to the human-centered design side of it, of really working with people to find out, what is it? What problem are you trying to solve? And does this technology solve it? And if that's the case, you end up with a much better chance of it being adopted. Here's this question about what are your recommendations for getting healthcare reimbursement for health-related technologies in the home? This is a really important question. And I think what needs to happen, of course, is the research that has to demonstrate that it makes a difference. And so that's a piece of always thinking about how to show what makes the difference. I'm seeing a lot more of insurance companies and even managed care type organizations adopting and paying for technology because there's a use case that's demonstrated. I think that it's starting to happen more with CMS. It's going to take time for that to happen, but I think a lot of it is the evidence that needs to be sort of mobilized around that. But the fact that healthcare insurers are starting to pay for things like iPads for communication and other kinds of monitoring devices really does make a difference. Misha, you got your hand up.
Yes, I do. Quick question. With the advances in robotics and machine learning and all that, there's still a lot of challenges in terms of the physical interactions, helping people getting dressed. And we haven't solved that yet. But in terms of language, we are much better. And I was wondering if it would be possible, like, for example, the case that you are outlining where people get exposed to directions and then they leave, and if they forget 90% of what was said, would you see any kind of issues about privacy, security, of monitoring the conversations and transcribing them so that they could come home and look at it?
Oh, I think that's such an important idea. And actually, I recommend to caregivers too, when they're getting discharged, to ask the nurse or whoever's giving them instruction, can I videotape this? So that they actually can get it, capture it, take it home and do it. And I think that's, that because it is, you can't retain all of that. It's too quick. And you also need to see, you can say to someone, oh, you need to change the dressing and do this, but you got to see, what do you mean and where do you put it? And so I think the videotaping part, now there's some providers who will say you can't videotape me, and they'll give you some stuff about it's a secure thing and all those kinds of issues. But I'm seeing a lot of places that are more age friendly, and hospitals and
Well,
emergency departments allowing it.
there is a liability issue. If
Yeah.
they could be sued for something that they said that led to it.
Yeah, well, but the thing is, if you're saying it and you're not willing to be taped when you're teaching someone, that's a question I'd worry
Yes,
about.
I agree. I totally agree.
Yeah,
Thank you.
yeah. I'm interested to know from the group the kinds of things you're working on, anything that you're doing around caregiving that you'd like to share. I'd love to hear from anyone in the group if there's something they'd like to share with the group now, bring forward. Holly.
Well, I don't necessarily have anything to share at the moment, but I wanted to see if you had a little more to say on caregiving for patients with dementia, and the current challenges and possible solutions there. It's a bit different.
Yeah, I think there are particular things with caregiving for persons with dementia. I think about different domains of support and care that people give to someone with dementia. There's the support around getting through the day, the basics of a routine that would prompt someone to be able to get through the day and to be as functional as possible. So, for example, what happens is you can't do the entire thing. So, for example, a dressing, someone's going to get dressed. With dementia early on, they may still be able to complete all of the dressing, but they don't have the initiative to start it. Or they might not have the ability to select what they're going to wear that's appropriate to the weather or what they're going to be doing that day. So the kinds of prompts you need and supports for that routine would be around matching it to their level of ability so they do all they can, but you support that. So that's the case with a lot of activities of daily living. The kinds of things that another category would be the kinds of instrumental activities like shopping, groceries, bill paying, and technologies that can support that and support the caregiver to do those in a way that's not so obtrusive. Another aspect is around the behaviors and detecting when someone's stress is rising and they're not coping well in a situation so that you can avert them escalating and having more problems. So mood detection and agitation, levels of agitation detection, so that very early on you can say, this is a situation that's deteriorating, let's do something different, it's a distraction, or there's an intervention in that moment that's really important. There are also issues around safety and making sure that the person is, things like the stove turns off, or not getting out and wandering if they are prone to do that and likely to get lost outside. And some of the technologies that are exciting, I think, are when the environment responds to prompt them. So if somebody exits the house, the sprinklers come on and they're spraying all over the place, they don't leave. Those kinds of technologies that are rather unobtrusive, but very responsive to the person and their needs are the kinds of things that I think are very important. And for caregivers with dementia, it's a very lonely job for a caregiver, and the social interactions become more and more absent as time goes on, so they don't have that connection. And so for the caregiver to have social connection and potentially access to support groups to be able to share what's going on with them and to have connection with others is a really important part, especially if they live in the same house. And that's, the quality of the conversation is deteriorating by the year in such a way that they're not being stimulated. And we've actually seen in previous studies that the cognition of caregivers declines while they're caring for someone with dementia. And this might be related to that paucity of intellectual exchange that you've been used to in social engagement. So ways to keep the caregiver active and engaged, whether that's playing games, doing different kinds of things with technology that keep them interested, and also social interaction, I think is really important.
Well, thank you. That was very helpful. There's one more question from Triva T.
Unlock, yeah, it's not everywhere. So Unlock was one. It was a demonstration project back a long time ago. I was just with the founder, Jenny Chen Hansen, yesterday, and it's many years since she started Unlock. It's an adult day program, so people can come for the day. They have to be duly eligible, Medicare and Medicaid eligible. And it's a day program where they have day health and they have services available. It evolved into the PACE program, which is the program for all-inclusive care for the elderly. And it's a national program under Medicare reimbursement. And the PACE program has scaled all over the country. And it's a very effective program. There's sites everywhere. And so it has, so Unlock itself, the name Unlock hasn't gone beyond Unlock, but PACE is what Unlock really became. PACE really was a demonstration. Unlock was a demonstration for PACE. So you can find PACE nationally. And so I would Google PACE, programs for all-inclusive elderly, and you'll find programs. And they tend to be more in urban areas, and it's very hard to get into rural communities, but they do exist, and they're very vibrant sources. Oh, good. I see David's got a pilot project that's working with PACE. Yeah. Any other questions or comments or things you want to share?
Thank you, Dr. Young, for your conversation today. This is Laura McIntosh. I'm in the Bay Area. And
Hi, Laura.
Hello. You have a comment in the chat saying that if somebody wants to collaborate with UC Davis, where would we contact the organization? Could you please answer that question?
Oh, sure. Thank you for bringing that to my attention. I'm going to give you my email. And I can put you in touch with people. If it's not me, somebody else. And it's
Thank you very much.
Also on the website. So thank you, Laura, for that. Well, it's been a pleasure being with you today. I really appreciate your attention and participation. I hope it's been helpful. And thank you so much for the invitation. I'm so happy you're all doing this important work.
Thank you, Heather. This is wonderful. Very, very helpful presentation. And thanks for all the questions too.
Alrighty. Thank you, everyone. Enjoy the rest of your day.